Join us now as we explore the story of our house. Homelessness in the United States is a growing problem in the most prosperous nation in the world. But in Atlanta, Georgia, there's one organization that's changing all of that, one life at a time. This is Our House, a place of refuge for those who have fallen onto hard times. Its origin represents America at its best. Since its inception in 1988, this movement has effectively addressed the root causes of homelessness.
Our House is a nonprofit organization that provides shelter to live and education to thrive. All of our programs work together to help families achieve their best lives. We provide early childhood education, we provide job training, we provide case management services. We provide the tools so that the children can grow and develop, so that families can have access to jobs, and so that as a unit, the family can grow and achieve their best life.
There is a certain stigma that goes with being homeless, but there are a number of mitigating circumstances that are often out of people's control. On any given night, there are as many as 40,000 veterans who are without shelter in the U.S. They account for just over 11% of all homeless adults. And generational poverty is a vicious cycle that has flooded shelters with those who have nowhere else to turn.
The chronic and cyclic cycle of homelessness for families, it truly is a moment in time that takes more than one intervention to break. So not only can they come here and get emergency shelter and housing, they can also get quality early childhood education and childcare. They also can get job training, and they also can get access to equitable health care. So it's important that we address them as entire units, as entire people, as entire beings. So we break the cycle, and Our House is really on the forefront of pushing for this type of model.
This holistic approach to restoring the human mind, body, and spirit has helped thousands of individuals since its inception back in 1988. Where many shelters just provide a short-term solution to a long-term problem, Our House is a place where hope is dispensed on a daily basis. It starts with health and safety. Once the basic necessities are stabilized, the people who need it are able to flourish and transition to living on their own.
People feel unworthy for all kinds of reasons, and if somebody can't walk in and get the care that they need because they don't have the ID, they don't have the money, and they're closed at the door, I think that also they internalize that. And well, if they won't let me in even for my vaccines, how can I ever think I can get housing, or how can I apply for a job?
The staff at Our House operates from a place of love and concern. Some have used their own personal experience to provide a level of empathy and understanding to the benefit of those who are suffering from the same illnesses.
As a person in long-term recovery, I felt that it was imperative for me to be able to give back what was given to me. Being here at Our House has brought a sense of humility because of remembering where I've come from and the journey of me actually getting to where I am now. So it's a very humble experience to be sitting on the other side of the desk now.
Rika's recovery from long-term addiction has allowed her to connect with countless others. Through a set of challenging and unfortunate circumstances, she found herself at the end of the road, looking for hope through the CAPN program. CAPN stands for Community Advanced Practice Nurses. Its mission is to provide a pathway to stability and independence.
Cabin put me up in a hotel, a very nice, expensive hotel for 30 days, and I got love. I got caring people that I thought that everybody was against me. And I finally found someone that wasn't. They helped me with my housing, everything that I asked them for, they did. It did it from their heart.
Since its inception in 1988, the faithful army of professionals at Our House have changed the trajectory of thousands of families forever.
I think the whole team at Our House are heroes. The nurses at our CAPN clinics are heroes in particular because they come to work every day to provide services for those who otherwise would not have access to quality health care. And they do it in a way that is responsive to the individual needs and that is full of compassion and caring.